Hello, 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 hello. I would like to I would like to discuss about new thing in a new manner, in a new way of a new entity. Okay, let's do some questions because the world is all about learning questions. Look at this question. Just look at this. A 13-year-old girl is brought to the office due to a heart bump on her left leg. She noticed how, when 3 weeks ago, it has not changed in quality and size during this time. She has had no trauma, fever, weight loss. Vital signs are normal on physical examination. She shows she showed a firm mass is palpated above the firm mass palpated above the left knee. Palpated above the left knee. What would be a single anteroposterior X-ray of the knee? A single anteroposterior X-ray of the knee is shown below. Without intervention or aggressive destruction of the local cortex, benign growth until facial closure, tighten ear, malignant transformation, pathological fracture due to medullary expansion, and spontaneous involution. Aggressive destruction, a heart bump 3 weeks ago. Maybe there may be, there may be benign growth of the facial closure. There may be benign growth of the facial closure. Benign bone lesion is osteochondroma, osteoblastoma, unicameral bone cyst, chondroblastoma, and giant cell tumor. These are the benign bone cysts. In here, there is firm, palpable mass, most likely osteochondroma. Osteochondroma, most common. There is a bony there is bony spar extending from metaphysis and away from the joint, and there may be contiguous medullary cavity and cortex. Natural is growth until facial closure. Natural causes there may be growth until the facial closure. Osteoid osteoma and unicameral bone cyst there is spontaneous resolution, and chondroblastoma and giant cell tumor. It is locally aggressive with extension into the growth plate or soft tissue. The extension into the growth plate or soft tissue. In chondroblastoma and in giant cell tumor, all of them has joint pain and swelling involving the long joint. In giant cell tumor, it also involves a long joint. In giant cell tumor is age more than 20. Both of them is well defined radiolucency with mm, thin sclerotic margin in the epiphysis. Thin sclerotic margin in the epiphysis is chondroblastoma, and in giant cell tumor there is soap bubble appearance. In giant cell tumor there is soap bubble appearance. So my way of learning should be 5 question at a stretch, then discussion. 5 question at a stretch, then discussion. Otherwise, I'm not able to finish it. From 5. In X-ray, there may be a fracture, radial fracture probably. Other bones look like intact. There may be fracture of the head of the radius. 45-year emergency department due to left wrist pain after a fall. Left wrist pain. Um, Medical history. He has celiac disease, hypertension, hypothyroidism, for his thyroid hormone supplementation. BMI is 20. Examination showed dinner for deformity at the left wrist. Dinner fork deformity. The din wrist is swollen and tender to palpation. Sensation over the left intact, and the extra of the most significant risk factor for this. mm, there may be malabsorption which leads to celiac disease. Malabsorption is one of the risk factor may happen. Okay, a 55-year-old man comes to the 55-year-old man comes to the office due to elbow pain. There is elbow pain for 3 weeks. The patient has vague achy pain in the left elbow that radiates vague achy pain in the left elbow radiates to the forearm. It is worse with activity at the end of the day, and it is not relieved with acetaminophen. The patient works in the airport baggage handler and has been in the office previously for minor occupational injuries. His medical history is otherwise. Her patient smokes half pack of cigarette. Range of motion normal. There is severe pain on the palpation of the there is severe lateral distal humerus. The elbow held in extension. Terminal passive flexion of the wrist. Terminal passive flexion of the wrist. Terminal passive flexion of the wrist. Mm, mm, with the elbow held in extension. With the elbow. A 28-year-old man is brought to the emergency department due to a construction site accident. Maybe concrete slab fell on his leg. Heavy concrete slab. The patient was strapped for the waist down for 15 minutes, and the patient had no pain. Blood pressure normal, pulse. Blood pressure slightly elevated. Pulse 110. Bilateral obvious deformity. Bilateral sounds are equivalent obvious deformity. Radiograph. revealed bilateral lower extremity edema, bilateral lower extremity, and the patient is cleaned of other major trauma. Is the mm, 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 24-year-old. Mm, history of joint pain. He has a mild achy. Uh, Okay, lots of time has gone, and I made you wait for such a discussion. Okay, look at this X-ray. There is a firm mass. There is look at this X-ray. Before looking at this X-ray, on physical examination, I got a firm mass. A firm mass palpated uh, above the knee, palpated above the knee joint. This left-sided X-ray and a firm mass palpated above the knee. There is a hard bump on the left leg. Notice 3 weeks ago, I have done this AP X-rays and found that this is a benign bone lesion, benign growth until this fascial closure, firm palpable mass above the knee on the X-ray, most likely osteochondroma. Is a yeah, it's a very common benign tumor composed of composed of bone with a cartilaginous cap. Bone with a cartilaginous cap. This is high talk that this is composed of bone with a cartilaginous cap. Mm, As X-ray revealing, there is metaphyseal exostosis. Like in simple word, we can say it's a bony spar, and in a hard word you can see it's a metaphyseal spar or exostosis near the exostosis near the metaphysis, projecting away from the epiphysis, projecting away from the epiphysis. Spar near metaphysis, projecting away from epiphysis. Uh, an X-ray revealing bony spar with a cortex that is continuous with the surrounding bone. Aggressive destruction of the local cortex can occur in bone tumor like chondroblastoma or giant cell tumor. There may be pathological fracture due to medullary expansion is caused by intramedullary tumor that can lead to cortical thinning and bone weakening like seen in cameral bone cyst. Unicameral bone cyst. This is unicameral bone cyst. There is a fracture line. This is well defined loosened lesion with a thin sclerotic, well defined loosened lesion in the thin sclerotic margin. Is a cameral unicameral bone cyst with fracture. Unicameral bone cyst with fracture. This is osteoma. This is also a small round lucency with a sclerotic small round lucency with a sclerotic margin. Small round lucency with a sclerotic margin. Mm, Small round lucency with a sclerotic margin. The second question. This is a very tough question. The second question, there is a 24-year-old woman. There is 4 week history of joint pain, 4 week history of joint pain and pain and swelling in the multiple metacarpophalangeal joints of the both hand, multiple metacarpophalangeal joints of the both hand. With a lesser pain in the wrists, knees, elbows. In addition, the patient experienced intermittent fever at the onset of her pain but has been afebrile since then. She has had relief of her symptom with over-the-counter ibuprofen, but in the week since she scheduled her appointment, she hasn't required medication as the pain has resolved. The patient is married and has two young children. Vital signs are normal. Examination shows normal range of motion in all joints with no redness, warm, swelling in any hand joints, and extra of the joints are normal. Which of the following is the most likely diagnosis? Mm, is a viral arthritis. How I can find this sort of arthritis? Is a symmetric polyarticular arthritis with a brief cell-limited course. In self-limited course, In the light of her exposure to young children, that is likely to viral arthritis due to parvovirus B19. Viral arthritis is associated with joint swelling and tenderness, but objective findings may be subtle or absent, whereas children with parvovirus B19 typically have characteristic slap rash. Mm, Adults more likely develop a non-specific morbilliform exanthem may have no skin manifestation. A similar arthritis may also be seen with HIV, mumps, and rubella. So, self-limited arthritis of parvovirus B19 may resemble early RA or SLE, or may be associated with a weakly positive RF or ANA titer. However, RNA are significantly less common, typically produce more obvious synovitis, usually follows a chronic protracted course. These patients, as 28-year-old woman brought to the emergency department due to uh, construction site accident in a heavy concrete slab fell on his legs. The patient was strapped from the waist, trapped from the waist down about 15 minutes, and until other workers have able to rescue him. After the patient is cleared of the major trauma, he is taken to the surgical stabilization and fixation. Local extremity succinyl choline is given for rapid sequence inhibition. With the use of succinyl choline, patient is at great risk of which of the following? Succinyl choline is a depolarizing neuromuscular blocker that works by binding with postsynaptic acetylcholine receptor to trigger the influx of sodium and efflux of potassium and through the ligand gate channels. Succinylcholine is often used in rapid sequence inhibition. However, certain patients it can be life-threatening. Cardiac arrhythmia due to severe hyperkalemia. Due to severe hyper, patient is experiencing extensive skeletal muscle. As this patient, this is high L. This is high L. There is skeletal muscle crash injury. So muscle breakdown, release of potassium. Muscle breakdown, release of potassium, and these high potassium can cause hyperkalemia. And we are using such sort of drugs, succinylcholine. It works by influx of sodium and influx of potassium by binding with postsynaptic acetylcholine receptor. We know that it's a depolarizing neuromuscular blocker, so it may cause cardiac arrhythmia as there may be hyperkalemia due to crash injury, and we are giving some sort of drug. These their side effect is cardiac arrhythmia as it is depolarizing agent, so high risk of having cardiac arrhythmia due to these electrolyte derangement. So the patient has experienced an extensive skeletal muscle crash injury, which places him at risk of hyperkalemia due to skeletal muscle cell lysis, rhabdomyolysis. In addition, skeletal muscle crash injury leads to upregulation of the postsynaptic acetylcholine receptor, which can result in massive efflux of potassium following administration of the succinylcholine. Other relevant conditions can upregulation of the acetylcholine receptor include burn injury, diffuse muscle atrophy, denervation, stroke, GBS, and critical. Other relevant conditions that can cause upregulation of the acetylcholine receptor include burn injury, diffuse muscle atrophy, disused muscle atrophy, denervation like stroke, GBS, and critical illness, polyneuropathy. To have a life-threatening hyperkalemia in such patient, non-depolarizing neuromuscular blocking agent like vicodinium, rocuronium should be used, as they do not affect the postsynaptic ligand-gated ion channel. So lots of things should be in your head before jumping into a mastery, before jumping into a doctorate. It's a very simple question. Elbow pain for 3 weeks. He's a baggage handler. Inspection of the left elbow show no erythema, and there is severe pain on palpation of the lateral distal humerus. Lateral distal humerus. With the elbow held in extension elbow, there is terminal passive flexion of the reproduce pain. Activity modification in elastic counter force brace and NSAIDs. The final one there is a fracture, distal radial fracture like Colles fracture, distal radial fracture, also known as Colles fracture. Distal radial fracture, also Colles fracture. There is this is Colles fracture. This is distal radius. This is fracture fragment. This is proximal displacement of the fragment. Distal displacement of the fragment, proximal displacement of the fragment, distal displacement of the fragment. Mm. And the five question series is already gone. Now I am going to take a break and we'll gonna start in a few minutes later. Hope you enjoyed. The next 5 1, I will gonna go in a time mode. It's a my style of going on a 5 and 5 uh, sequence. 5 5 5 sequence.
Oh,
A 29-year-old woman. uh, She came to me back then. The last week she has had moderate non-radiating moderate pain in the lower back. That started after she had spent the weekend in the raking leaves in her yard. The patient attempted treatment with a heating pad and ibuprofen, but no relief. She has no fever, no extremity weakness, no urinary symptom. Medication. BMI 34. She's kind of obese like me. Examination should tenderness in the right lumbar paraspinal region. Tenderness of the right lumbar paraspinal region with normal, with normal, with normal spondylosis, with normal neurologic findings. SLR straight, negative, most likely next to back pain, low back started. How many days? For the last week, she had. She is obese. She had opioid, strict bed rest, never MRI or an X of the lumbar spine. You can order a X of the lumbar spine. You can add a non-measurable and we can add as his muscle spasm, right lumbar chest tenderness in the right lumbar paraspinal region with normal neurologic finding. You can add a non-benzodiazepine muscle relaxant. আমার কাছে ছবি তোলা আছে, পাঠাই দিব। হ্যালো। হ্যাঁ, আমি কি জানি না, ওনারা হয়তো মেরে চাকরি দিচ্ছে। হ্যাঁ, মনে করে কইছে যে যায় না, হঠাৎ করে পরে আর যাই নাই। পরে বাবু ভাই, পরে ঘুরে গেলাম কেন, অনেক সময় লাগছে ওখানে। এটা সত্যি একদম কম্পিউটার ইন্টারভিউতে আছে।
না আছে কোনো গোছানো পাস, না আছে কোনো দৃষ্টিনন্দন আক্রমণ। পর্বের শেষ ম্যাচে কলম্বিয়ার বিপক্ষে ছিল যদিও খেলার প্রথমে এগিয়ে গিয়েছিল ৫ বারের বিশ্ব চ্যাম্পিয়নরাই। ম্যাচের ১২ মিনিটে ফ্রি কিক থেকে বল জালে পাঠান বার্সেলোনা ফরোয়ার্ড রাফিনিয়া। ১৯৯৯ সালের পর কোপা আমেরিকায় সরাসরি ফ্রি কিক থেকে গোল পেল ব্রাজিল। ২৫ বছর আগে আর্জেন্টিনার বিপক্ষে সবশেষ ফ্রি কিক থেকে গোল পেয়েছিল সিনেসাওরা। গোল পাওয়ার পরেই কলম্বিয়ার একের পর এক আক্রমণ সামলাতে হয় ব্রাজিলকে। প্রথমার্ধের যোগ করা সময়ে সেই আক্রমণের সুফল পায়।
Lots of time, lots of struggle, lots of hurdle. I'm going draw. Okay. What your old man comes to you due to pain in the right hip for 4 weeks. The pain increases with weight bearing. She has no morning stiffness. She has SLA diagnosed 7 years ago. Her current medication hydroxychloroquine lansos low dose. She's afebrile. There is another hurdle. No pain is elicited. Gait is antalgic. Plain film radiograph of the right hip are normal. Which of the following is the best immediate step in the management for this patient? One is going to hard dose, joint aspiration, MRI. It's a complication of the SLE, avascular necrosis, and the risk is greatly increased as she is taking glucocorticoid for a long-term use. Patient taking long-term glucocorticoid as well as underlying SLE diagnosis done. Vascular necrosis. Now I'll go through near about up to 15 questions. Uh, then I will. The next, a 13-year-old girl is brought to the clinic by her mother due to difficulty walking. The patient noticed a mild ache in both hips 2 months ago that occurs most days after waking from school. Difficulty walking, 13-year difficulty walking. The ache usually resolves after rest. The ache have worsened to the point where she has difficulty walking, and ibuprofen only minimally relieves the symptoms. Her mother attributed the symptoms to the muscle soreness related to the deconditioning because of the patient gained noticeable weight over the past year. The patient has no chronic conditions, takes no other medications. Height is 75th percentile. Her weight is 97th percentile, and temperature is 37.4 degrees Celsius. The patient has a waddling gait with both feet turned laterally, waddling gait with both feet turned laterally. Bilateral knees have full range of motion. Bilateral knees have full range of motion. Both hips are externally rotated during hip flexion. Both hips externally rotated during hip flexion, and there are no palpable clicks when the hips are brought back to the extension. There is limited internal rotation bilaterally. There is mild tendon. There is mild tenderness to palpation at the bilateral anterior groin. Which of the following is the most likely diagnosis? 3 to 8, not transient synovitis. He has bilateral. Uh, it is not osteosarcoma because the aches usually resolve after rest, but this week. Uh, mm, Both hip externally rotate during hip flexion. Both hip externally rotate during hip flexion. This is physiologic genoverum. A 17-year-old girl brought to the office for evaluation of the right knee pain. For the past 3 months, the patient has fully localized achy pain in the anterior right knee that is worse when she runs and sits for extended period. She has been taking no NSAID. She has been taking NSAID, which partially relieve the pain, but have lost effectiveness over time. The patient has also sensation that the knee is giving away. The knee is giving way. She's running very normal gait with the knee extended, compressing the patella with the extended, compressing the patella with the knee extending, compressing the patella to the trochlear groove to produce pain. There is avascular necrosis, there is osteonecrosis. This is the picture of osteonecrosis or avascular necrosis. 35-year-old man comes to the office for follow-up of low back pain. He has aching pain in the left lumbar or spinal area that is worse at the end of the day, and then relief. Moderate residual pain. There is no associated fever. The patient is employed as a factory line worker, requiring to lift 5 to 7 kg daily. On physical examination, the patient appears comfortable cervical but flexion and extension of the lumbar and elicits pain. On physical examination, the patient um, straight leg raising is normal. There is mild tenderness in the lumbar. There is mild tenderness in the left lumbar paraspinal tissue, but no midline tenderness. Upper and lower extremity strength and upper and lower extremity, upper and lower extremity strength and deep tendon reflexes are normal. Which of the following is the best? Which of the following is the best recommendation for management of the patient's pain? Hmm. Best recommendation for the management of the patient's pain is continue working until the pain is resolved. Epidural injection, epidural glucocorticoid injection, exercise therapy, lumbar support brace, and scheduled dose of benzodiazepine. Scheduled dose of benzodiazepine. Upper and lower extremity strength. A 35-year low back pain, follow-up low back pain, aching in the left lumbar paraspinal that is force at the end of the day, that is force at the end of the day and relieved overnight with rest. The pain begins 3 months ago. The patient is employed as an extension. The 2-month-old girl is brought to the clinic. Back. Our parents concerned about back, her head being flat on the right, her back on flat on the right, tortical lace. Social diplomacy. Thoughts equally. If you do not know, boy is brought to the office for evaluation of the both leg. Evolution of the both leg. Mm, mm, the boy appears to have worsened since he has started walking. The patient not appear with pain or still able to play. It's a on examination for the legs. The patient, a 52-year-old man, comes to the clinic follow-up of non-healing wound in the right leg, non-healing wound in the right leg. 8 months ago, the patient had the patient had an open fracture of his right tibia due to motorcycle accident. His injury was not surgically treated. His injury was not surgically treated for the 2 weeks. However, he has had occasional fever. Hello, diagnosed sleep capital female adolescent girl, chronic aching, limited internal rotation of the hip, consistent with adolescent girl, chronic has a chronic aching and limited internal rotation of the hip, consistent with sleep capital femoral epiphysis. Why it is not physiological genu valgum. Developmental normal leg alignment in 2 to 5. Affected children typically have no symptom on leg, unlike adolescent girl with chronic pain and abdominal pain. Adolescent girl, 13-year-old girl, difficulty in walking, mild ache in the both hips. Adolescent girl, mm, difficulty in walking, mild ache in the both hips 2 months ago. The aches are resolved after rest, but these weeks the aches have worsened to the point where she has difficulty walking. And ibuprofen only minimally relieves symptoms. Ibuprofen only minimally relieves symptoms. Her mother attributed to the symptoms to muscle soreness related to deconditioning because the patient gained noticeable weight over the past year. The patient has no chronic condition and takes no other medication. Height is 75 percentile, weight is 97 percentile, temperature is 37.4. The patient has waddling gait with bone bilateral knee, have full range of motion, both hips externally rotate during hip flexion, and there are no palpable clicks when the hips are brought to the back. Hips are brought back to extension. Both hips externally rotate during hip flexion. Both hips externally rotate during hip flexion, and there are no palpable clicks when the hips are brought back to the extension. There is limited internal rotation. There is limited internal rotation bilateral. There is a limited internal rotation bilaterally. Mm, there is mild tenderness to palpation at the bilateral anterior groin. Sleep capital femoral lipase, obesity, and adolescence, articular dull hip pain, referred knee pain, altered gait, limited internal rotation of the hip, limited internal rotation of the neck, australly displaced femoral head on X-ray, no weight bearing, surgical pain, avascular necrosis, and osteoarthritis. In patellofemoral pain syndrome, quadriceps strengthening exercise is a must. Quadriceps strengthening exercise is a must. Anterior knee pain typically has the patient poorly localized anterior knee pain. Young girl, anterior knee pain. The patient has poorly localized achy pain in the anterior knee. Anterior knee pain that is worse when she runs. Anterior knee pain when she runs and sits for extended period. Sits for extended period. Goes up and down in the staircase. Poorly localized anterior knee pain that is worse when she runs and sits for the extended period goes up and down one staircase. NSAID partially relieves the patient has that sensation knee is giving away when she is running. Normal gait. This young girl right anterior knee pain. Words when she runs sunsets or extended pure goes up and down.